If you're in your 30s and watching this video, you absolutely need to see this through. Right now, irreversible changes are beginning in your body. If you're missing the early signs of sarcopenia that start at 30, your body will look completely different in 10 years. How did you feel getting out of bed this morning? Did it feel slightly heavier than before? This is the first warning signal that sarcopenia is sending. While most people dismiss this as simple fatigue or stress, muscle is already starting to disappear. Why muscle loss begins in your 30s? Many people think sarcopenia only affects the elderly. This is a deadly misconception. Sarcopenia begins at age 30, stealing 1% of muscle mass every year. While this is biologically inevitable, early detection and proper response can absolutely prevent it. Several factors cause sarcopenia to start in your 30s. First, hormones crucial for muscle synthesis, like growth hormone and testosterone, begin declining. Second, physical activity decreases, reducing muscle stimulation. Third, protein synthesis efficiency starts dropping. The most frightening aspect is how gradually these changes occur. Muscle doesn't disappear overnight but progresses slowly over years, so most people don't notice until reaching a serious state. First, self-assessment. Daily life changes. Early sarcopenia signs appear in small daily life changes. Check if you've experienced these situations. Do you feel more breathless or heavy-legged, climbing stairs than before? This signals early lower body strength decline. Healthy 30-somethings should handle 3 flights without difficulty. Does lifting heavy objects feel harder than before? If lifting 10 kilograms feels challenging, suspect upper body strength decrease. Do your back or legs hurt quickly when standing long periods? This could signal decreased core muscle and lower body endurance. Do you struggle opening bottle caps or tearing tough packaging? This indicates declining wrist and forearm strength. Does your body feel stiff and difficult to move when waking up? This signals decreasing muscle flexibility and function. Second, self-assessment. Physical measurement tests. Now let's explore more specific physical measurements for self-diagnosis. These tests are easily done at home while providing very accurate indicators. Calf circumference measurement is the simplest yet most accurate method. Measure the thickest part of your calf with a tape measure. Men under 34 centimeters and women under 33 centimeters should suspect sarcopenia. The calf is called the second heart and is an important muscle mass with high correlation to total body muscle. Thigh circumference is also an important indicator. When measuring the thickest part of your thigh, men under 50 centimeters and women under 45 centimeters need attention. Grip strength measurement is also a good method for evaluating overall muscle strength. Without a dynamometer, try squeezing a tennis ball as hard as possible. If you can't maintain it for over 10 seconds, suspect strength decline. The chair stand test evaluates lower body strength. Cross your arms over your chest and time how long it takes to stand up and sit down 5 times. Taking over 12 seconds likely indicates beginning lower body strength decline. Third, self-assessment. Balance and endurance evaluation. Sarcopenia affects not only strength but also balance and endurance. Check with these tests. Try the single leg stand test. You should be able to stand on one foot for over 30 seconds with eyes open. With eyes closed, you should maintain over 10 seconds. Shorter times signal declining muscle coordination and balance. The 6-minute walk test is also useful. Measure the distance covered walking as fast as possible for 6 minutes. 30-something men should walk over 700 meters, women over 650 meters. Try the stair climbing endurance test. Check if you can climb to the 3rd floor without rest, and how quickly your heart rate returns to normal afterward. If your heart rate stays elevated for over 5 minutes, both cardiopulmonary and muscular endurance may be problematic. Fourth, self-assessment. Lifestyle pattern check. Sarcopenia is closely related to lifestyle patterns. Check these items. Do you sit for over 8 hours daily? Prolonged sitting is a major sarcopenia cause. This problem has worsened especially since COVID-19 increased remote work. Do you exercise less than 150 minutes weekly? The World Health Organization recommends minimum 150 minutes of moderate intensity exercise weekly. Less than this increases sarcopenia risk. Is your protein intake less than 1 gram per kilogram of body weight? From your 30s, adequate protein intake becomes essential for muscle maintenance. Do you sleep less than 6 hours daily? Or have poor sleep quality? Growth hormone is primarily secreted during deep sleep, so sleep deprivation directly harms muscle synthesis. Are your stress levels high? Chronic stress increases cortisol secretion, promoting muscle breakdown. Fifth, self-assessment body composition changes. Scale numbers alone cannot diagnose sarcopenia. More important are body composition changes. If your weight stays the same, but clothes feel looser, you've likely lost muscle and gained fat. Pay attention to body shape changes where arms and legs thin, while only the belly protrudes. Check muscle definition in the mirror. If muscle lines in your arms, shoulders, and thighs appear less distinct than before, this could signal muscle mass decrease. Whether body fat percentage increased is also an important indicator. Even at the same weight, losing muscle and gaining fat decreases metabolic rate and increases various disease risks. Sixth, self-assessment blood test values. Blood test values from regular health checkups also help diagnose sarcopenia. Check your creatinine levels. Creatinine is a muscle metabolism byproduct that decreases as muscle mass declines. Even within normal ranges, consistently decreasing trends require attention. Albumin levels are also important. Albumin reflects protein nutritional status and often appears low in sarcopenia patients. Vitamin D levels must also be checked. Vitamin D deficiency directly correlates with strength decline and should be maintained above 30 ng/ml. Testosterone levels are also important indicators for men. Testosterone, which decreases 1% annually from age 30, is essential for muscle mass maintenance. Seventh, self-assessment functional evaluation. Sarcopenia means not just muscle mass decrease but functional ability decline. Check through these functional evaluations. Can you climb stairs 2 steps at a time? This is a simple method to evaluate lower body strength and power. Is it difficult to squat down and stand up to pick up dropped items? This comprehensively evaluates lower body strength and joint range of motion. Is reaching for items on high shelves difficult? This evaluates upper body strength and shoulder joint function. Is walking at fast speeds difficult? Walking speed is an important indicator, reflecting overall strength and cardiopulmonary endurance. Is lifting your knees to your chest difficult? This evaluates hip flexor and core muscle function. Eighth, self-assessment pain and fatigue evaluation. Sarcopenia often accompanies chronic pain and fatigue. Do you tire more easily than usual or recover more slowly? When muscle mass decreases, the same activities require more energy and recovery time lengthens. Do you have chronic pain in your back, neck, or shoulders? This could be pain from weakened core muscles and postural muscles. Is muscle soreness after exercise more severe or longer lasting than usual? This could signal decreased muscle recovery ability. Does fatigue persist even after sleep? Muscle mass decrease can also affect sleep quality. Ninth, self-assessment mental changes. Sarcopenia accompanies not only physical but also mental changes. Have depression or lethargy increased? Muscle mass decrease can cause confidence loss and depression. Has your concentration or memory declined? Compared to before, muscle and brain are closely connected, and sarcopenia can affect cognitive function. Has motivation for social activities decreased? Confidence loss from declining physical ability can lead to social withdrawal. Importance of early detection and response. Why is detecting sarcopenia in your 30s so important? Because complete recovery is possible when found at this stage. Recovery is much faster and more effective than when discovered in your 40s or 50s. Early response has 3 key elements. First, starting appropriate resistance exercise. Strength training at least twice weekly is essential. Second, adequate protein intake. You need 1.2 to 1.6 grams of protein per kilogram of body weight. Third, lifestyle improvement, adequate sleep, stress management, smoking cessation, and moderate drinking are necessary. Most importantly, regular monitoring. Repeat the self-assessment tests presented above every 3 months to track changes. If there's no improvement or worsening, consult a specialist. When professional medical care is needed, professional medical consultation is absolutely necessary in these cases. When 5 or more of the above self-assessment items apply, when experiencing continuous strength decline for over 3 months, when function has deteriorated enough to interfere with daily life, specialists can make accurate diagnoses through precise body composition analysis, strength measurements, and gait analysis. They can also establish customized treatment plans suited to individual conditions. If this video helped you, please hit subscribe and like, and turn on notifications so you won't miss useful health-related information. We're rooting for your healthy future.